My name is JoAnn, and I'm from Eau Claire, Wisconsin. I'm married. My husband, Chuck, is Senior Vice President of a bank here in Eau Claire. And I have two daughters. One is 22, and she goes to school at UW-Madison, and the other daughter is 18, soon to be 19, and she goes to school at UW-Stout in Menominee. And I am a stay-at-home mom, so to speak, a homemaker. In June of 2005, I noticed that one night when I was watching TV that I had a dull ache on my elbows. The next night that dull ache in the elbows moved up the back of my arms. And subsequently, a couple of days later, I noticed that I had breathing problems. I thought because of the hot and humid weather that, this was maybe a case of pleurisy. And I went in to seek medical attention for it. And I did this a couple of times during the month of July. And at the end of July, I was just really having terrible breathing problems. So I went into Luther Hospital here in Eau Claire, which is an affiliate of Mayo. And I was diagnosed with a silent heart attack, which had destroyed the left side of my heart. And subsequently, I was transferred over to St. Mary's, where Dr. Zier decided, after checking all alternatives, that the best thing was to implant a mechanical heart called the HeartMate. And I was there until September 14th. And then I came home and subsequently did physical therapy at Luther Mayo, and then turned around and ended up having my mechanical heart malfunction. And I ended up in March, after being upgraded in January to a 1A, in March I had to go and stay at St. Mary's, and on April 3rd of 2006, I received my heart transplant. And sure enough, when I had the transplant, I got this nurse named Val that night, and I kicked her right out of my room, and she had done nothing wrong, and I felt terrible about it the next day. But my time that I spent there at St. Mary's in the month of March was fantastic. I told Dr. Franz once, if I had this to do all over again, I think I would still go through this, although I would want to omit all the pain. I thought this is going to be so difficult, but it wasn't. It was probably one of the best experiences I've ever had because of the people that I met, the nursing staff, the doctors, the employees, the janitorial staff, who would come in and talk to me. A lot of times I don't think that people realize how much they can affect a patient just by saying hi or making small talk if that patient doesn't have any family that's staying right there. And they can make a big impact on a person. And I really appreciated what they did with me. When I came in March, he looked at me and he said, "Okay, JoAnn, you can hook yourself up to the machine." That's when I still had the mechanical heart. And I looked at him, I said, "I don't do that, Paul." I said, "Paul, I'm kind of like a princess. I'll do anything else. I'll clean toilets, I'll wash windows, I'll do anything else, but I just won't do that." So he turned around and he walked out and he goes, "The princess." And then the next day, Anne came in, the nurse, and she said, "Is there anything that you would like me to bring up at the meeting? We're going in with the doctors now, and is there anything that you would like to bring up?" And I said, "Well, yeah." So she left and she came back and she said, "Well, I went in there and Dr. Edwards was in there, and I told Dr. Edwards that the princess says, and this is what he said to tell you. He will allow you to go to the Canadian Honker for lunch, absolutely no to the mall, and he will reduce the number of blood draws and chest x-rays every week, and he said to tell you that the king will be in shortly to see you." I know that I was a difficult patient in the ICU, I know that, but they did save my life. I am very appreciative of it, and I am very appreciative of the way that they treated me as a friend rather than really as a patient. I mean, I got to know my nurses and my doctors, and I really enjoyed them.